In this video, I'm going to demonstrate functional dry cupping to the shoulder region. This is going to include the pectorals, anterior, lateral and the posterior deltoids as well. The aim of this is to increase range of motion around that shoulder joint area in functional movements. So this is why we're in this seated position. Okay, now with the functional dry cupping, the same when it comes to static cupping, we still need to apply medium to the area that we're going to treat. So for the purposes of today, I'm using the physique lotion, okay, but you could use wax or you could use oil, whatever you normally use within your clinical work. Okay, so we just need to apply a film of lotion to the area. Okay, so I'm just being mindful of the client's clothing here and making sure I'm placing some medium onto the pecs and also onto all of those heads of the deltoid region too. Main reason for this is that when the client starts to do the movement techniques, the cup is going to slide slightly. And if we haven't got the medium in place, it's going to stop some of that suction from the cup or some of that connectivity. And also there's going to be too much friction. So it will be uncomfortable for the client. Okay, so I'm using the hand sole cups today. When you're thinking about the cups that you're going to use, you need to look at the size of your client. So I'm going to place the first cup onto the pectoral area. So from here, I'm going to use a standard size cup. I'm coming into the upper fibers of the pecs, just below, you can see Lydia's clavicle here. So we're just below that clavicle line. Okay, and I'm going to make sure that the cup is nice and secure. So I've put about 1.5 pumps in here. The amount of suction that you're going to use is going to vary depending on the amount of tension in your client's muscle tissue. Okay, so I've just used one and a little bit of pumps here. Then I'm going to use a slightly smaller cup for the anterior deltoid area. Okay, because I do want it to be at the front of the shoulder. Okay, but you need to be mindful that it doesn't slide too near towards the joint line here. So I'm just going to reposition that because as I've applied it, it slid a little bit too much towards that joint line, and as soon as Lydia would start moving, the cup would lightly come off. Then I'm going to use a standard size cup on the lateral head. Okay, and again, a standard size cup on the posterior head of the deltoid as well. Okay, so we can see we've got 4 cups on here. So pecs, anterior deltoid, lateral deltoid region, and the posterior deltoid region as well. Okay, now what we can do is we can start doing those movement techniques. Okay, so I'm going to guide the client through the movements first. So we're moving the client passively at the moment. This is going to help to create a stretch in the tissue because the tissues are already on stretch, and then we're going to be moving the limbs, so it's going to create a deeper stretch for the client. Okay, but also we want her to do these stretches herself so that it's providing that functional release. Okay, so we're going to guide her through the movements first. We're going to take the elbow. So I'm just lightly moving the elbow up into lateral flexion here. Okay, and then we're also, so I'm just going to do that a couple of times so the client knows this is the movement that I want them to do. Okay, then also we can take this arm back into horizontal extension of the shoulder. Okay, now here we're going to be feeling more of a stretch on those anterior deltoid fibers and the pec fibers too. Okay, then also we want to do rotation at the shoulder. So again, I'm just guiding the client here on the movement that I want her to do. So this is external rotation. She can also come into internal rotation there as well. So with the cups in place, the client's going to feel a bit of a stretch. I'm lightly supporting underneath the arm here. Okay, and that's going to help her to keep this elbow up. And then also we're going to take the arm across the chest here too. Oh, we've lost a cup. Okay, I'll replace that in a moment. So because we've got the cup on the back of the arm there, the client is still going to be feeling that stretch. Okay. Excellent. So we're going to relax that down. Lydia now knows the movements that I want her to achieve. Before she starts doing them, I'm just going to place that cup back on. Okay, does that feel nice and secure? Okay. Actually, I'm going to check all of these. Make sure they're still on nicely. Okay, right. And if you'd like to work your way through those movement techniques, so lateral flexion first. Excellent. And then the client can keep going about 3 to 6 repetitions. There, can you feel that movement? Mm-hmm. Excellent. And then from there, if you want to come into external rotation. So she's keeping the elbow up in line with the shoulder if they can. If the client can't achieve this movement, then that's fine, or this depth of movement, and that's absolutely fine. Okay, and then the opposite direction, so internal rotation. Excellent, and just noting to see whether your client has got more restricted movement in one direction than the other. Perfect, and then come back into horizontal extension. And if you do that extension first, it then doesn't matter if that cup on the pec falls off when you come into that flexed position. Yay. Perfect. So 3 to 6 times ideally. If your client is still feeling a really strong stretch after 6 repetitions, then you could do more. You could do about 8 or 10 repetitions as well. Okay, so that was our functional release using vacuum or the dry cupping modality to increase range of motion around the shoulder joint.